Good evening, Dr. Yannick. How are you?
I'm fine, thank you.
This is my first time to attend the IDS, but how about you? How many times have you come here?
This is the second time I come to the IDS.
Second time.
Yes,
Yeah.
and it's very huge.
Yeah. What do you like about the IDS? What makes you interested in this event?
It's interesting because you can see a lot of products, a lot of new products. You can see a lot of brands, and as well a lot of people, very interesting people.
Yeah.
It's a unique meeting in Europe, and I think in the world.
I see. And was there anything interesting for you this time? Did you find something that you was like, yeah, this is a good thing? Were you looking for certain materials or certain technologies? Did you find something interesting?
Yes, currently I am interested on implant, of course, and biomaterials.
Yeah.
And I'm looking as well into digital impressions because digital is a huge importance now in our
Field,
job,
right?
of course.
Yeah, yeah. And you're also going to give a lecture at the speaker's corner, right? Can you give us a little bit of information about the
Yes,
lecture?
tomorrow I will give a lecture at the GC stand, and I want to thank GC for inviting me or for giving me the opportunity to give this lecture.
Mm-hmm.
This lecture will be about the ridge preservation before implant and during the implant placement. So I will explain a little clinical case about that.
I see. And I don't know in France, but I don't know, many general dentists might do some extractions, for example. And then obviously, if you don't place an implant or a material, some bone resorption happens, right? Do you have any comments or any tips for dentists on ridge preservation that you can share before the lecture?
Yes. First of all, I think the planning is the more important, or you have to study your case to anticipate and to avoid the surprise. So if you have a good planning, you can choose your treatment, and you can prepare your case and prepare your material, because each case is almost different. So the more you work on it, the easier will be the surgery.
I see. And for example, like earlier, I saw a lecture in which extraction was done in order, because the tooth was dead and there was a preapical lesion. But the technique of the extraction is also quite important, right?
Yes.
So can you talk to us a little bit about, if we plan to extract a tooth, what should we always keep in mind to make sure that we don't hurt the bone?
Yes, we have to keep in mind to do very minimal traumatic extraction. I won't say atraumatic, because an extraction is always traumatic, of course.
Yeah.
But we have to prepare to have a minimally traumatic extraction. So we have to be careful when doing that. And now we can use tools like the Bonnet system. We can use as well piezo surgery. So we have a lot of tools which will help us to be the more safe as possible.
I see. And for example, like piezo surgery, like I saw the device today in the video and in that presentation. Can you talk to us a little bit about the benefit of using this device? What does it do?
First, there is no heat when you work with the piezo surgery, and it is very atraumatic. So you can split the root, and you can with a very it's very delicate. It's a very delicate. It could be maybe a bit longer, but it's very nice, and the bone is not suffering at all. So biomaterial is good, but the bone of the patient is the gold standard.
Right, right. And so, for example, when you're extracting the tooth, you would prefer to cut it into pieces first and then extract every root alone? instead of, for example, keep on like using a forceps or an elevator, that basically hurts the bone a lot more, right?
Yes, I think the time we will waste during the extraction, we will be rewarded for this after, because the result will be better.
Right.
So
And-
actually, it's not a waste of time, but
It's part of the
sometimes,
procedure,
yes,
right?
it's a part of the procedure. And sometimes you can feel you could be quicker, but no.
It's
you must
better to take
your
it
time.
slow,
Yes,
right?
Yes.
Yeah. Okay, so about the lecture, can we go back to the lecture and talk to us a little bit about what information can you share with us about ridge preservation that you'll introduce in the lecture?
Well, we said about minimally traumatic extraction,
Yeah.
and after the biomaterial is very important, and you have to prepare the good biomaterial depending on the case, and of course as well I use a lot PRF,
All right.
so I
yeah,
mix it with the biomaterial, which is it's very nice too.
I see. And as for biomaterials, like it's still not available in Europe, but in Japan we have a material called Cytrans. Have you heard of it?
Yes, of course, I
Yeah.
heard about this.
We are very excited about maybe it's coming to Japan, to Europe, maybe hopefully soon.
Yes.
But the concept of it is these kind of material interesting for you, for example?
Yes, definitely.
Yeah.
I think I'm looking forward to trying it as soon it will be available in Europe.
In the market, yeah.
And yes, that's the type of material I currently use when I extract the tooth and I put an implant immediately.
I see.
Yes.
So during immediate implants, this is the kind of material that you...
Yes, definitely yes.
What properties do you makes these kinds of materials suitable for immediate implants?
The biomaterial, the particles must be not too large,
Yeah.
so it's easy to fill the gap between the socket and the implant.
Uh-huh.
And as well, it should be easy to put in place, like I don't know, a syringe, or easy to manipulate.
It's right. And as for like let's say like patients that come to your clinic, you're obviously implant specialists, right? How often do patients that come to your clinic require not just one implant but multiple implants? Is that mostly the case or no?
Well, we have many different things.
Yeah.
But yes, it's quite. I'm surprised because it's quite frequent. We have to do a complete rehabilitation.
Of the oral
Yes.
cavity generally.
Yes,
So
sometimes. But currently we have, of course, single cases with one implant, or maybe 3 or 4 implants. It depends.
yeah, but because the reason I asked about that is because this material that we have, Cytrans, has different sizes, different shapes, different amounts of amounts of the material itself. So you can actually use the amount that you need, right? If you just use one implant, or you will have like smaller amounts, and then if you can customize it, right?
Yes, exactly.
Yeah.
Actually, depends on the location of the implant. For example, for a direct sinus lift, you will use a lot of material and large particles.
Yeah.
And for example, in the aesthetic zone, for immediate implant placement, you will use small particles, and this location is very critical, the aesthetic zone. So you have to be very conscientious, and you have to put all the tensions in our side, and of course in the side of the patient.
I see. And the material being completely resorbable. So this material is completely resorbable, right? Is that an important property for you, or maybe not so much?
Not necessary.
Not necessarily.
It's good to explain to the patient that maybe in a few years there will be no biomaterials. But sometimes it's not important, and sometimes the patient doesn't matter.
Doesn't care.
Yeah.
I see. Okay, so in the end, just if there is one point that you want to share with the listeners as a takeaway point from this podcast or from the lecture that somebody will attend, what would it be?
Let me think. I would say what is very important is the quality of the material, and because there are a lot of material, and I think what is important is the quality of the material, how it has been manufactured, and the seriously of the brand. Because sometimes you can hear about a lot of biomaterials. We don't know where it comes from. So I think it's important for the patient to be sure of the quality of the material
The quality of
in
material.
the long term.
I see. So thank you very much, Dr.
Okay.
Yeah,
Thank you very
appreciate you.
much.